And I think the most important thing to recognize is most of the transmission across this country is related to people who are unvaccinated. That is where the majority of transmissions are occurring. We acted with the data that we had at the time. The data that we had at the time, the country mostly had alpha. Alpha among breakthrough vaccinated infections was not being transmitted to other people. The data that we have right now is different. We have a country that is full of Delta. Delta is a more transmissible virus, and the new data that we have is that Delta is able, in those rare breakthrough infections, to be transmitted to others. The most important thing that we need to say right now is we have a lot of this country that has a lot of viral burden. That's driven a lot by people who, and mostly by people who are unvaccinated. Those are the people that are driving the new infections. But at an individual level, we believe everybody should be wearing a mask in those areas of substantial and high transmission. We've been following the science to see that there's much more virus that is in your nasopharynx when you're unvaccinated and you have Delta. And now we have new science that is just happening from our outbreak investigations that has demonstrated that those rare people with vaccine breakthroughs can potentially give disease to someone else. I believe that a vaccinated person who believes that they can't, who might think that they can't transmit to someone else and might go visit an elderly person or an immunocompromised person, needs to be empowered with the information to know how to protect themselves so that they don't pass disease to someone else unknowingly. Again, things that have changed since our initial guidance with schools. We are now a country that is the majority of Delta. We know that our young children, 11 and younger, cannot be vaccinated. We know that our vaccinated individuals, in the rare case that they're a breakthrough, have the potential to pass the virus on to unvaccinated individuals. We know that our 12 to 17-year-olds right now have only about 30% coverage in being fully vaccinated. And so taking all of that information together, we believe that the CDC recommends that K through 12 schools should be opened for full-time in-person learning, but in those indoor settings, everyone should be masked and should mask and take other proper prevention strategies to keep those schools safe.